All right, I want to thank everybody for coming. We are rolling out a new health care plan because the plans that we've been hearing involve too much government and too much insurance, or too much insurance companies, which has been a big part of our problem. So I want to run through this and just say, if you liked my tax holiday idea, then you'll love this. The idea is simplicity, but especially this plan will give every American the treatment that the American needs when you need it, with the doctor of your choosing, at a price that is affordable and will be covered by your health savings account, or it's more than you have in the health savings account, it'll then be covered by your insurance. And so let's talk about some of the principles here. Number one, everyone will have and be part of a health savings account. If it's a multi-family or multi-person household, a family, then you can have a household health savings account. I know when I was going through school, we had 5 of us living in a house trying to save money. And so what happened, we just shared expenses. Well, if you're living together in the same household and you'll just sign a form as to how the health savings account will be divided upon dissolution of the household, then you have a household HSA, which also makes the insurance cheaper than it would be if it was only done for one person. Also, you have the catastrophic insurance that is above the amount of your health savings account. So if you're a single person, we propose a $2,500 health savings account as a minimum. But you can go way beyond that if you want to. Your employer can pay more than that if he or she wants to. And if you are single and you're on Medicare, Medicaid, or S-CHIP, then you won't need those. You'll have more control. It's your control. It's what you decide. And you'll have the money that the government will put into your health savings account and pay for your catastrophic care beyond that. If you're a household and you're on Medicare, Medicaid, or S-CHIP, then there will be a $3,500 amount put into your health savings account. So, senior citizens, I know seniors, I've talked to lots of seniors about this idea, and their number one concern is, gee, what if I get hit with a $150,000 medical bill? I've seen how much these things cost, and so I couldn't afford that. Well, the truth is, you haven't seen how much the insurance company or the government pays, because it's a tiny fraction of that huge amount that you will see reflected in bills that are sent to you. So seniors will be better off because they'll have control. If you're a senior, you'll have complete control of your health care. No more checking to see with some government bureaucrat on whether you can get the medicine or the health care that you actually want and need. You go get it, because you'll have a debit card that allows you to just pay for it. And if it's above that, you'll have insurance to cover beyond that. So seniors and those who are, whether you're elderly, sick, chronically ill, and so you couldn't get an insurance policy, you will be able to get it just like everybody in states has car insurance. You'll be able to get health insurance and be better off than when the government controlling your program. So seniors will have full coverage and complete control. So no more worrying about what you're going to do because they won't pay for this type of oxygen or won't pay for this procedure. You got a debit card, you just pay for it. Also, paying for your treatment is simple, and you'll have what you need to do it. Everybody knows what it is to just swipe a card at the grocery store. Same kind of deal. If it pertains to health care, then your debit card, when you slide it through, will be able to pay for that. If it's not health care related, then the debit card will not be successful in paying for it. Also, you get complete transparency. You pay only a tiny fraction of the bills you see these days. For example, you have Well, I'll give a personal example. I know of one case recently. The medical bills were over $10,000 for 2 days after a car wreck. $10,000. When we got to the bottom of it and found out how much the health insurance actually paid in full, the full $10,000, it only cost $800. Well, I know when somebody says, well, gee, I don't know if I can afford $100,000 or $200,000 bills. I've seen those things that came in after I've been hospitalized. Well, you may be shocked to know how very little that the insurance company or the government, Medicare, Medicaid, actually paid. Because it's a tiny fraction. And we don't have transparency. You go to the grocery store and you know for sure how much you're going to pay for a product before you pay for it. Well, healthcare providers, if it's a hospital, a doctor, physical therapist, whatever it is, you'll know how much you're going to be charged. So you can shop around. And just like if you needed an appellate lawyer, you would not have to go to a general practitioner in order to get to go see an appellate lawyer. You contact whatever kind of lawyer you feel is appropriate. It ought to be the same way with medicine. You should not have to go through somebody else and beg them to send you to the specialist that you know you need. That just shouldn't be happening. So, transparency enough. If an insurance company pays $100 on a $1,200 bill and it's paid in full, you ought to be able to do that too, and you will under this plan. Also, veterans are special, and having been a veteran and talked to so many veterans, most of the veterans I talk to like their health care, but they're concerned that they're going to get ripped off and they'll lose their care, the special care they get, because there are veterans clinics and hospitals that deal specifically with veterans' problems. That ought to continue. We owe those who've served this country a debt of gratitude and the kind of health care that will take care of you for having served and protected us. So, veterans will have the same care if they want it. If they'd rather have a debit card insurance above that, that's their call, but veterans are special enough. They get to have the same if they want it. And as I was pointing out, this system we have now of having to have a gatekeeper, I hate it. I know doctors, I know the different specialties. I want to go to the specialist. If I know I need an ear, nose, throat doctor, I'd like to go to an ENT. I don't want to have to go through 2 or 3 different visits in order to get a chance to go to the specialist. That alone would cut down on health care costs. And so the doctors will be free as they were, when I was growing up, to say, sure, I'll take a new patient, or to say I'm full on patients. But it's between the doctor and patient. That's where it should have been all along. And the plans that I've been hearing do not restore that back to us, and the kind of decision making that each individual should be able to make for themselves. Also, we know that there are many, many, many people who are immigrants that come into the emergency room, go to see the doctor, and we end up having to spread that cost across America. Some people hire migrant laborers and say nobody else will work this cheap. Well, part of that's because the rest of America is paying their health care costs. That ought to be borne by either the people getting the health care, or if the employer is bringing in migrant workers, then he could set up a migrant worker, temporary worker, health savings account that would cover those individuals. So the plan is simple. It adds a requirement to getting a visa to come into this country, just like you have with many countries. They set out requirements in order to get a visa. Well, one of them will be that you'll have to show that you have a health savings account that's waiting for you, either through your employer or with the household where you're going to be living, that they have a health savings account for the household that you'll be able to participate in, and that you'll have insurance above that. This system we're under now, and the one that's been proposed by the president, will break the bank. Some are saying, well, it'll take care of things. It won't. It will break this country, and we don't need any more of that. We need to get back to responsible spending on health care. This plan keeps our country from going broke. Anybody that's willing to be honest and be sincere and look at this issue responsibly knows that Medicare, Medicaid, S-CHIP are breaking the bank. You put that on top of the trillions of dollars that have been obligated in the last 9 months, and you see we're in big trouble. And that's what happened to the Soviet Union. They overspent. So to have a plan like this that saves money will save the nation that we love so much. Just so you know, the latest figures we've been able to get show that in 2007, Medicare had grown to $431 billion. That was 2007. Medicaid spending grew to $329.4 billion. That's over $760 billion for Medicare and Medicaid. We also know that when you look at the number of people on Medicare, Medicaid, and S-CHIP, separate individuals, you have around 93 million people. We know that most people in America have an employer that will pay their health insurance. This is going to save the employer. Nearly every employer will come out better doing this. You put money in a health savings account and pay the catastrophic insurance that picks up where the cash leaves off, and it'll be cheaper than having these insurance policies that go up 20 to 40 to 50% a year. Most employers simply cannot afford to do that. We're losing jobs. I'm hearing it all the time. We're losing jobs because employers are saying we cannot keep up with healthcare costs, and since the one employees we keep want it, then we've got to lay off people so we can pay for healthcare. So these are important issues. A couple of other things I'd like to point out, though. If you have more than $2,500 if you're an individual, or $3,500 if you're a household in your health savings account, then invest it. Put it where it will be making you money. But unlike a retirement account where you can pay like a 40% tax and penalty and pull it out, once this money goes in, it's going in pre-tax, and so it will need to be used for health care or stay in the account. But if you build up such a big amount, then you may want to gift some of that to your children or to other loved ones who need a nest egg. Likewise, it rolls over year after year and will get bigger if you have some left. And so when you pass away, it's part of your estate. You can leave that to your heirs to give them a bigger health savings account and a bigger nest egg. Some statisticians have told us that young people in their 20s and 30s right now start putting people's money aside. Those people will have so much money in their accounts by the time they retire, and by the time they need assisted living, they can have the best assisted living that they can get. And again, this gets us on a road to being solvent as a nation. And when you can do that and give individuals so much more control of their own future, then it is a win for everyone. So I tell you, I have a health savings account right now. I've had it for 2 years. I don't like it. The insurance company has too much control over my health savings account, and I want it to stop. This way, I'll have a health savings account. You'll have a health savings account that you are in charge of. I know I keep hearing from people, well, I wanted to get this medicine, but the insurance company said that wasn't covered. My doctor said it would be the best for me. Under this plan, you go get it. And you give them the debit card and they slide it. It may be at the end of the year, say you're a family household and you've got $3,500 and you didn't use but $2,000 of it for the year. You can allow that $1,500 to keep rolling over. Or maybe at the end of the year, you want your family to all have LASIK. Maybe you want LASIK. Well, you got money in there that'll go get it. You need another pair of glasses. This will cover the glasses. Over the counter, prescription, those kind of things will be taken care of. You go to the pharmacist you want to. You go to the doctor you want to. You go to the healthcare provider you want to. This is all about you, the patient, being in charge of your future, your health care, and also what an incredibly great byproduct to get that control and to save hundreds of billions of dollars. Because we know that of all the households, around 112 million in America, roughly a third of those are single individuals. So you do the calculations of that, how much it would cost the government to put $2,500 in a single person's health savings account. You look at how much it would cost for family or multiple person households to put that $3,500 into their health savings account, and then the amount. I've only gotten rough estimates, but we're saving probably $200 billion or more dollars a year. The president said he wanted his cabinet to come up with ways to save $100 million. Well, try saving $200 billion in 1 year. My friends, this can work. This can happen. It's not going to happen until America lets President Obama know we want control of our health care. We don't want a government bureaucrat telling us we're going to have to die because we can't get the medicine we need. We don't want a bureaucrat at an insurance company telling you you can't get the treatment you need. So that's it in a nutshell. And having lost my mother and seen her decline, I know what it is very personally to see the kind of cost that we're talking about. Having family members and myself, I just had my knee fixed end of last year. I know what these things are shown to have cost on paper and what they actually cost from health care. And that's what we got to get back to, full transparency. I'd be glad to take questions. Anybody wants to ask something?
Can you talk a little bit on the health savings accounts? I don't have numbers on top of my head, but I just think like a ball and I'm sure you have any sense for how the American is getting ready for control. Is that going to move people into that?
Well, that's a great question. And yeah, I mean, like right now, if I talk to somebody, I tell them I'm not happy with my health savings account because I don't have the control I should have. And I think that once people know they have control and they have insurance to cover beyond that, that they're going to be thrilled to death with the prospect of getting to call their own shots. I think the main thing that the obstacle we will have is for some seniors to understand they get control of their health care and there won't be any $150,000 bill coming to them they can't pay. That probably costs less than $15,000 when somebody gets a bill like that these days. But they get control and they're completely covered, and I think that's the important thing to know. But it's no wonder they're not that popular right now. Some people have never heard of them. Some unions, I'd understood, did not want to even discuss them. And if I were a union leader right now, knowing how health savings accounts are right now, I would be leery of them too. We're talking about a completely different concept in health savings accounts where you own it. You own it. It is yours. It is your property and nobody can take it away from you. And as long as you're alive, you own it. When you die, what's left goes to someone else. But that's a great question. Thank you. Right.
Not like each child gets $2,500.
No, because if you look at what insurance costs these days, insurance for a household is much cheaper than the insurance for an individual would be added together of all those in a household. Insurance is cheaper, and therefore it'll be less costly, and so you wouldn't need as much. If it turns out that we need to tweak that, then we will tweak it. That's an easy thing to do. The big thing is to get this concept into law, and I realize that we've got a long uphill battle, But, you know, only a third of Americans supported the American Revolution, but people were dedicated enough. They made it happen, and they brought the other 2/3 and their future generations to great blessings because of what they did. Good question. Sure, of course.
Where's the gap between the cost of legal costs?
Well, actually, the doctors, the hospital providers, they would love to just charge, you know, what it costs and give them a little profit, rather than having to play these ridiculous games that the government requires so that a hospital may bill $1,500 for staying one night.